It can be hard to lead a normal life if you have post-traumatic stress disorder. It can cause you to want to avoid friends and family. You might have anxiety attacks if you go into ordinary places. There are ways to manage the symptoms of this disorder if you have it. So, we are going to watch about the how to deal with having PTSD. Post-traumatic stress disorder.
Method 1. Getting professional help. First is get a proper diagnosis.
PTSD is an anxiety disorder and the symptoms can often overlap with other similar conditions. In order to receive a diagnosis of PTSD, you must have a history of exposure to a traumatic event. Step 2. Talk to a therapist who has experience working with trauma victims. Therapists may use cognitive-based treatments that focus on helping you to identify and change your thoughts and beliefs. Different people heal in different ways, and it's important to choose the treatment option that best fits your situation.
Step 3. See a psychiatrist for medication management.
Selective serotonin reuptake inhibitors, SSRIs, are the most commonly prescribed medication for PTSD. Other antidepressants, mood stabilizers, and other medications may be helpful. Each medication carries its own group of side effects, which you should discuss with your physician.
Finally, participate in support groups.
Receiving a new diagnosis such as PTSD may be difficult to come to terms with. Taking part in a group helps you to see that there are millions of people out there managing this disorder.
Method 2. Living with PTSD. First is take care of your body and mind.
Many people have found that getting adequate exercise, eating a diet of healthy foods, and enough rest can make a significant impact on PTSD. Facing PTSD and seeking treatment is courage in itself.
Step 2. Keep a personal journal.
Write down anything that bothers you during the day because these situations or object might be triggers for nightmares or flashbacks. Also, write down how you are feeling and whether your symptoms are particularly bad or okay that day.
Step 3. Lean on family and friends.
Pay attention to when your symptoms are especially intense and try to spend time with loved ones who make you smile and comfort you. Find support through peer support groups and connect with others who have or are experiencing PTSD.
Finally, become a voice for others.
Raising awareness for a mental illness that you are affected by helps you and helps others in the process. Advocacy enables you to transform a terrible incident in your life into a positive message.
Method 3. Controlling panic.
First is recognize the signs of an impending panic attack. Excessive stress or fear can cause panic attacks, and panic attacks often co-occur with PTSD. Persistent fear is an underlying aspect of having PTSD. Sometimes, you may begin to feel extremely panicky without any obvious signs.
Step 2. Practice deep breathing.
The mind, body and breath are all interrelated. Taking a few minutes to engage in purposeful breathing can offer a wide range of benefits. This technique can be useful in reducing anxiety, fear, and even aches and pains.
Step 3. Try progressive muscle relaxation.
Progressive muscle relaxation also makes use of deep breathing for even greater impact. Another technique found to be effective at reducing anxiety involves a gradual and systematic tightening and releasing of each muscle group.
Step 4. Meditate.
Meditation can be helpful at preventing panic attacks from occurring. Start small with about 5 minutes per day and progressively sit for longer periods.
Finally, try to minimize worrying.
Develop a few positive self-talk strategies for when you find yourself worrying over and over again. These can be telling yourself, "I will be okay," or, "This, too, shall pass."
We hope it is useful to you. Please subscribe to our channel to upskill yourself.